Good morning, life. It's time for PSHE this morning. So today we're going to start a new topic, a new section of our PSHE journey for the year, and we're going to be looking at healthy me. Our topic for this half term is healthy me. So before we go further, why don't we just take a minute and just have a little think about what steps do we take to keep healthy? Think about all the things that you do just to keep healthy. Okay, so what did you think? Did you think about what you eat, your diet, the food choices that you make? Did you think about exercise, activities, things that you do that you know are good for your health? What about things like making sure you stay well, making sure you don't get sick? So things like the good hand hygiene that we do at school and things like that. There's loads and loads of different steps that we take in order to stay healthy. Some of them can involve choosing to do things, and some of them involve choosing not to do things, so making steps away from activities or things that would be bad for our health. Now today we're going to look at emergency aid procedures and things that we would need to do to keep either ourselves or other people healthy in sort of emergency situations. So we're aiming to know and put into practice basic emergency aid procedures, including recovery position, and know how to get help in emergency situations. That's our kind of aim statement, our jigsaw aim statement today. So what do we mean then by an emergency situation? What type of emergency situation do you think you might find yourself in? So pause the video and have a think. What kind of things would happen that would mean you maybe would end up in an emergency situation? So what did you say? Did you say things like maybe out and about in the park or on the beach or places like that where somebody hurt themselves? It could be at home, couldn't it? It could be, just at home with parents and there's an accident, somebody trips, falls, burns themselves or cuts themselves, or any kind of medical emergency situation like that. It could happen anywhere. And it's just the kind of what we can sort of glean from this is it's really difficult to predict. You can't know when these kind of situations are going to happen. They can range from a cut finger, the simplest little thing, small little injuries, right through to someone maybe collapsing or being unresponsive and needing urgent medical care. All of these we would kind of class under emergency care or first aid care. So depending on the situation, our response needs to be proportionate, the right kind of response to that sort of situation. So our response to somebody cutting their finger, if it's a small little cut, is going to be very different to our response to somebody collapsing on the floor and not responding to us. So what we'll do then is we're going to come up with some situations. I'm going to talk to you about some simple situations, and we're just going to have a think about what the right response might be. Now, there is no one correct answer for these, and lots of us might have slightly different opinions. All these scenarios are going to happen in the same setting. So imagine this setting. We're playing at the park with some friends, okay? There's no adults with you on this occasion. Now, it might be that you do that now already, or maybe you're thinking in a few years' time when you're a bit older, you might go out kind of on your own. So you're out with some friends without adults. You're 2 minutes away from home, so pretty close to home, playing at the park, and one of these incidents happens. So for each scenario, I want you to think about what the right reaction might be. I'm not necessarily asking you to be a doctor and say what medication or what kind of treatment the person needs. What would your reaction be just as a friend, as a person there? What steps do you think you should take? Okay, so our first scenario is we're at the park, 2 minutes from home. Our friend falls off the monkey bars. He stands back up straight away, and we see that his knee is bleeding a bit of blood coming from his knee. After a couple of minutes, there is still a little bit of blood coming, but it's only a small amount really, and your friend says, look, I'm fine, we'll just carry on, it's no problem at all, we're absolutely fine. What do you think we do there? What's the right course of action to take there? When you pause the video, have a little think. Well, like I said, there's no one correct response, and this is where I'd love to be in a classroom and hear some of the different answers that you might come up with. It depends on that. You might decide, actually, you're fine, and it's not going to stop us. It's not going to hurt you in the short term. Some injuries, these kind of things, actually, what we're trying to do is prevent a sort of longer term problem. And cuts and scrapes and things, they need cleaning and dressing and and plasters applying and things like that. So probably the right response here is pretty soon to get back home, get somewhere where you can get the cut cleaned up, and get a plaster put on it if necessary. So I would say the right sort of area of response is to try and say to your friend, let's go and get it cleaned up, get a plaster put on it, and then we can come back out. Let's try something else then. What about your friend falls off his bike and hits his head on the floor? So you're cycling through the park, falls off his bike, seems to hit his head, and then you pull over next to him. He's lying on the floor and he doesn't respond to you for about 30 seconds. Calling his name, he's just lying on the floor. Looks like he's kind of asleep. Starting to look a bit worrying, but then after 30 seconds, he does wake up and he sort of comes round. He says he feels fine and just wants to carry on riding, wants to carry on going. Pause the video and tell me what you do in this situation. So this one's a little bit more serious, isn't it? It's a difficult one because you've got your friend there saying, I'm fine, don't worry about it, let's just carry on, it's no problem at all. But quite worrying that he's been on the floor, unresponsive for a period of time. Now, does this warrant us getting our mobile phone out and calling for an ambulance? I don't think, if you were to do that, I don't think the person at the other end of the ambulance is going to tell you off or say you've done the wrong thing. It might be that if your friend's able to walk and you're not quite sure what to do, that the right thing in the situation is to get home, take that short walk home and ask an adult and find out a little bit more, and maybe the adult can call a sort of non-emergency medical response. But definitely, I think the thing to not do here is not to just carry on. In this kind of situation where we're worried that we don't know what's gone on, we don't know what's happened, this is where we need help. We need an adult's help, or we need some more medical help. So I think that definitely we can't necessarily pick out exactly the right thing to do, but the wrong thing to do would be to just carry on as if nothing's happened. You either need to get to an adult or get some emergency medical care. Okay, now it's not your friend. Let's change it up to something else. You see someone lying face down on the floor, so a stranger, face down on the floor. The dog that's with them is really distressed, really angry, and when you shout to the person doesn't respond. There doesn't seem to be anyone else around. You're on your own. You're just you and your friends. There's no one else around apart from you and your friends. What are you going to do in this situation? So hopefully you had time to have a little bit of a think there. You pause the video and have a thought on how to think about it. So what did you think? If you've got a mobile phone with you, did you decide maybe to call 999? I think you're definitely right to, if you did decide to do that, because somebody's unresponsive. They seem to look like they need pretty emergency medical care. So the right thing to do there, I think, is to phone 999 if you can. Obviously, if you didn't have a phone with you, you could try and shout for help, see if you can attract somebody else's attention. Or if you can't see anybody, you could try and find somebody to help you. But I think the right thing to do, if you've got a phone with you, would be to phone 999 and get some emergency help there. What's interesting about this situation is it says that the dog is distressed. The person's dog is very angry and quite distressed. It raises an important point about these situations. If we come across some kind of emergency situation, we need to make steps that make sure we don't become in ourselves an emergency situation. So don't get yourself into a position where you might hurt yourself. So you don't want to come over to this person to try and start helping them if in the process you're going to get bitten by an angry dog. So it's important that we make a quick assessment of what the right thing is to do, bearing in mind our own safety is really important. In fact, it's of the utmost importance, because if we get injured as somebody trying to help, then we've got two casualties instead of one, and nobody can help the original person. So if it's safe to do so, you could try to help him. But this brings us on to our next point. Sometimes we need to call for emergency help. And the number that we call for emergency help is really straightforward. We call 999 from our phone. This service is there for everybody. It's free to use, so don't worry if you don't have any data or whatever left on your phone or anything like that, you can always call 999 from your phone. And sometimes I think it even works if you don't have any network with your particular provider, but there is for another mobile provider, you can still call 999. It does still work. What is it for then? Well, you need to call 999 in an emergency situation. Now, if we're thinking about health and medical emergency, this is when someone's seriously ill or injured and their life is at risk. So this could include a loss of consciousness, so that they're being out cold, someone having difficulty breathing, it could be a really severe cut with a lot of bleeding, this sort of thing, any kind of really, really serious situation. What it's not for is it's not for messing around with, is it? For jokes, for phone up and see what happens, phone up and make something up. I think we all know really that's a terrible idea, because what that does is it wastes the time of really, really important people. So what happens then when you call 999? Let's find out a little bit about it. So when you call 999, all you've got to do is answer questions. The person at the other end of the phone will ask, is a professional, a really, really skilled call operator. They ask you the important questions and you just have to answer them. So if ever you have to call 999, all you got to do is answer questions. If you don't know, you should say that you don't know, and the person at the other end will help you. They will ask you where you are. So it's important, if you're in an emergency situation, to get an idea of where you are and be ready to tell somebody where you are. And the last point is that you don't hang up until you're told to. So just listen to the person at the end of the phone and they tell you what happens. All right. Talking of where you are, we can take some steps in advance to help us with this. And you can get some apps for your phone that can help. You can get a GPS app like Google Maps, which will tell you exactly where you are. Or there's a really, really clever one called What 3 Words. What 3 Words is an app that gives every particular part of the UK a little 3-word code, so that you can tell a call operator exactly where you are. So that's an app you can get for your phone, and it is free, that you can, if ever you were in an emergency situation, you could tell the call operator exactly where you were so they could get help to you. Now, something that's worth knowing, and I did put this is one of our jigsaw aids for today, is to know how to put someone into a recovery position. So the recovery position is used when someone is not responding, but they are breathing. So if we think back to our scenarios, something a little bit like our falling off the bike scenario, where someone is fallen off the bike, hit the head, they were not responding to us, we got close to them, we found that they were breathing, we could see that they were breathing and feel their breath, they were breathing, but they're not conscious. And this is important to put them into the recovery position. So we're going to listen to and watch the experts now show us how to put someone into the recovery position.
If you've done a primary survey and established that your casualty is unresponsive but breathing normally, they should be placed into the recovery position to help maintain the airway. To do this, kneel next to them on the floor. Remove their glasses and any bulky objects in their pockets, but do not search their pockets for small items. Make sure both of the casualty's legs are straight. Then take the arm nearest to you and place it at a right angle to their body with the palm facing upwards, like so. Take the other arm and bend across their chest and place the back of their hand against their cheek nearest to you and hold it there. With your other hand, lift their far knee up until their foot is flat on the floor. Whilst keeping the casualty's hand pressed against their cheek, pull on the far leg and carefully roll the casualty towards you and onto their side, like so. Once you've done this, adjust the top leg so that it is at a right angle. Tilt the casualty's head back so that the airway remains open. If needed, adjust the hand under the cheek to help to keep the airway open. If it has not already been done, call 999 or 112 for emergency help. Keep checking the level of response until help arrives. So remember, if the casualty stops breathing at any time, call 999 or 112 and prepare to give them CPR. And that's how you place someone in the recovery position. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk/donate.
So today's task then is just to have a go at that. Have a practice with somebody at home, a couple of goes to see if you can master putting somebody in the recovery position. And I'll see you next time.